Library Board of Trustees meeting. I'm Jim Hanley, I'm the board president. As we typically do, we'll introduce ourselves. Two of our members will be online, and Michael Dunn will not be able to attend today. So we'll begin then with you, Carolyn.
Good morning. I'm Carolyn Guy, Vice President.
Good morning. I'm Sandy Hallenstein. I'm Board Treasurer.
Good morning, Tressa Setluck, board member. Sorry, Janice.
That's all right.
Hey, John, you're next.
Good morning, John Walters, board member.
And Janice, you're final.
Good morning, Janice Wallflower, board member.
Okay, thank you. Okay, we do have a quorum. Certainly 6 of 7 constitutes a quorum. So the first item on the agenda is the approval of the July meeting minutes. So I'll make the motion to accept the minutes from July, and if I can get a second.
Second.
Okay, any questions, comments, or changes? Okay, if not, I'll ask for a voice vote. All in favor indicate by saying aye.
Aye.
Opposed?
Aye.
Okay, motion carries. Okay, the next item on the agenda is the expenses, or EALs as we entitled them. So again, I'll make the motion to accept the EALs, and if I can get a second.
A second.
Okay, are there any questions about anything on those reports? Okay, so I'll make a motion to accept them. I made the motion to accept them. All in favor indicate by saying aye.
Aye.
Aye. Okay, opposed?
Aye.
Okay, motion carries. Okay, now the treasurer's report. So Sandy, you're up.
Okay. All we have this month is a reimbursement of the summer intern costs. Back when we approved the budget for our Vanguard accounts, we authorized $2,000 for the summer intern to be paid from both of our accounts. What I did was I went back and I looked at the dividends earned both in 2019 and in 2020, because that's what we do. We take the dividends from the prior year in the account and we apply them towards the intern's costs. We did not have an intern in 2020, so I'm going to apply, as long as no one objects, I'm going to apply the dividends from 2019, which was $505.67, and the dividends from 2020, which was $350.88, for a total of $856.55 to come out of the Rudolph account, and that will mean we'll take $1,143.45 from the original Vanguard account to make up for the difference, plus add 8 cents, because it looks like there was an additional 8 cents on the earning amount.
Okay, as Sandy indicated, that's a report. We don't vote on anything, but any questions? If not, okay, I'll move on to Smyrla, which actually is really nothing to report. Just as a reminder, when we meet as a board at Smyrla, what I try to do is to convey to this board things that are applicable to the county libraries. And really, all of the discussions pretty much were around issues that were unique to the operations of Smyrla. So really, there's nothing to pass along to this group. So unless there's any questions about Smyrla in general, we'll move on to Michael.
A quick agenda, or a quick addition to the Smyrla is that we are working to move forward with the Southern Maryland Regional Library Association on the RFID project. So that's getting a start, and it will allow us to put tags on all the materials, which will allow better inventorying and faster checkout for our customers. It'll be a convenient thing because people can check everything out at once as opposed to each individual item. So we're looking forward to working with Smyrla on that project and are very grateful as always for their help. Start with some celebrations here. We have 2 anniversaries of note. The first is a 15-year anniversary, and that's for Tammy Jones, who is at Lexington Park. And the other one is Ben Sweeney, who began work with us, but is now working as a substitute, and he's been working with us for 5 years. So congratulations to both of those. The other thing I'd like to mention, and haven't had a chance to do a hip hip hooray for yet, is the NAACP Back to School event, which was this past Saturday, and the library had a table, and the Friends of the Library also came out and gave away free books to everybody. We gave away quite a few backpacks with the NAACP, and the NAACP is, we didn't give away all the backpacks, so I was going to give some to the library to give away to people. Not everyone might have been able to make it to that event that day. So we'll be working a way to notify the public that we have some backpacks available for pre-K up through high school. So that's good news, and thank you, Janice and the NAACP, for working with us on that. It was just a lovely day, building the future through education. It was terribly hot, but other than that, just a fine day, and we had a lot of vendors out. They were giving out COVID vaccinations, just a great all-around day there. And thank you to our library staff who were there. I'll be getting you your hip hip hoorays. Take a quick look at the budget so far for this year. I think the only thing that will be of note will be it looks like we've paid no health insurance so far this year, and that's because we're working on some things with our accountant. Those payments haven't been made yet, but we're on track to do what we typically do with health insurance, and hope that the cost will stay, relatively low. So other than that, it's still early days, and we are just doing just fine on all of our expenditures for the year. Any questions about the budget so far?
Getting back to the health insurance for a second, excuse me. How often is that normally paid?
We pay that monthly.
And why is it not paid based on your comment about the accountants?
Michael, can I answer that?
Yes, please do.
The county held up the bill because there were some issues with it. So the county receives the bill and then sends our part to us. The health insurance company dropped everybody in June and then didn't put them back on correctly for the July bill. So the county had to send the bill back and get a revised bill. So they just sent me the bill last Friday. I've already had it signed by Michael and it will be paid this week. That was for July. August bill, my county contact told me that she's working on it this week, and she also already has September's bill. So both of those will come in this month. And I have budgeted for that, and I'm aware of the costs of those because they are about $40,000 for each bill.
And I think you answered my subsequent question, which is going to be, does that mean there was or is a lapse in coverage back there?
No, there is no lapse in coverage. They just billed incorrectly. They just dropped them from the bill, but there is no lapse in coverage. They will continue to be covered. Anything that occurred for any of our employees at that time would be covered because it was just an accounting error by the insurance company.
Okay, thank you.
Yeah, Michael, on the page 4, under the section of charges and fees, there's a miscalculation. If you look at service income, it's $3,237. Then fines, $3,024, but the total is $3,237.
I will correct that
So it looks like one of those 3 lines just didn't get added in. Thank you very much, Jim.
Okay.
And yes, the insurance bill is some $43,000 a month, and I groan every time I sign it. But it is such an incredibly valuable and important thing for our employees who are eligible. My only regret, in fact, that it's not more, and I wish there was some way we could find to cover everybody, but we do insure through the county, and people have to work at least 30 hours a week in order to be eligible. So we do offer some supplemental insurance through AFLAC, and some of our part-timers are able to take advantage of that as well. So.
Michael, I'm curious, do the employees have a contribution?
Yes, they do.
They do.
15%.
15%, okay.
And that's been fairly standard for the county. There has been discussion over the years of raising the employee contribution, but so far the county has not done that, and we're just following them in that measure. Okay, well, you've already seen the intern cost. I just like to note one thing about the intern, and that is we've got something of a tradition of our interns eventually becoming St. Mary's County employees. In this case, it happened very quickly. Our intern became an employee of St. Mary's County as soon as the internship was done. We had an opening. She was eligible for it, so she has joined us. And that continues to be a really great way to introduce people to the library career and to what St. Mary's County Library does. And so we're just incredibly grateful to you, the trustees, for funding that position.
She joined as a full-time or part-time?
Belinda, full-time? I think it's part-time.
She is a part-time
Yeah,
librarian at Charlotte Hall.
Yeah.
Okay, thank you.
A quick ARPA grants update. We did get two, as we talked about previously, the mobile library grant and then the ebook grant. For the mobile library, we're working with Mr. Svandowski, who is the one who helped Calvert Library put together their mobile library, which will be launching very soon. We have an RFP out on the street, and so far we've got one response to that. We are moving forward for the full project, and so that's a little bit more than that the grant would allow for. So we'll be looking for alternative sources of funding for that, and we've talked about a couple of those last month. But also, when we present, as we will a week from tomorrow, to the county commissioners, we'll already be, and informally I've talked with a couple of them and said, hey, this is coming along. So we'll be looking to get their support for the mobile library. Specifically, next year, we'd like an FTE or two for it. So we'll be asking for that. And the commissioners I've talked to have already said, well, you know, we can't tell you yet. We need to see what the budget's like, but it sounds like a great request. So I'm hopeful that we'll see that project continue to move along. The kind of news on it is that when we initially got the grant, they said it's vehicle only, but we said, well, we were kind of hoping to get a staff member hired who will begin to do community outreach, work with daycares, work with senior centers, work with neighborhoods to start establishing a schedule and what we're going to do, work with our partners on that. And we got letters of support from the NAACP, from Health Department, from the Department of Social Services, and start thinking about maybe some joint programming we can do with them. So that will be moving along. And we do have permission then to think about hiring somebody, and we don't have to do that for a while yet. The vehicle will not be on the road until at least probably September or October of the following year of 2022. It takes that long to put it together. It is all custom done, so we're looking forward to that. On the ebook grant, which is really for the state and not necessarily for St. Mary's County Library, we're working with a company called Lyrasis, which is deploying a new version of the Simply E-app called Palace, as in Palaces for the People, which was Andrew Carnegie's fond name for what he called the libraries he helped fund. And that should be ready, a draft version of it, by the end of September. We'll be trialing that just to make sure it works. We have a kind of a holdout with one of our vendors, Overdrive, who it took them 3 years to decide they would let Simply E have access to their audiobook titles, which we license through them. And so the state library and I have appealed to Overdrive to say, we need that content. You've already given it to us. Basically, just release it for this version of the app. I'm pleased to note that that new app will have content that had previously been excluded from libraries through Amazon. Any of their publication imprints will be available. That's about 10,000 additional titles. And it's not like they're just going to be sitting there. We will be working with the state to provide access to those. But I'm hopeful that some of that content will become available, and I'm not really allowed to talk about another vendor who's coming on board, but it looks very likely that another large entity who's been withholding content from libraries has decided to come to the table. So we look forward to talking about still more content libraries have not been able to have previously that they are now going to be able to get. Well, officially, I don't know that the Maryland law that was passed and came into effect this past June had anything to do with that. I'm pretty confident that it might have played a factor in their decision. I did share with you an article from Publishers Weekly from last Friday talking about our further hopes for that legislation, what we'd like it to do. Many publishers are already giving what we consider reasonable terms, but a number of the biggest publishers who release about 95% of the bestsellers have terms that are not nearly as favorable as what we can get when we look at our print materials. And we're just hoping that through negotiation we might get a slightly better deal. And we'll just see if that happens. Unfortunately, I think there was some misinformation put out by a lobbyist for the publishers saying that Maryland was planning lawsuits. I assure you that that is not true. We have no plans to do any lawsuits related to the publishers. Our statement to them was just an invitation to talk, and we're hopeful that at least some of them will come forward and talk with us about what they might consider to be reasonable costs for us. It's hard for me to understand why a ebook would cost $60 and expire after 2 years, when for a print book we can get it for about $15, $16 in hardcover. And of course, it never expires. It will wear out over time. It could very well be that the first time somebody uses it, they'll spill coffee on it and we can't use it ever again. On the other hand, we've got books that are years old. I mean, how reasonable would it be for the publisher to suddenly say, all your hardcovers are now $60 and you got to weed them after 2 years? It just doesn't seem like libraries are getting a square deal there. So we in Maryland are advocating for getting a better rate. So that's kind of an update on what's happening with those grants. Any questions about those?
Can we back
I don't
up
have a
to the
question,
mobile?
but I have a comment. And I'd like to thank you again, Michael, for being at the forefront of the efforts to get this legislation going and to level the playing field for libraries. It's going to make a huge difference to people in Maryland and eventually, hopefully, around the country as well. So thank you.
Oh, well, you're certainly welcome. It's a passion, but I do think that it's something that will be good for Maryland readers. And so far, New York has passed its legislation, although the governor hasn't signed it. Of course, the governor up there having some issues of his own. We'll just happen to see when the new governor comes along, when that will happen. Some other states are interested in, and the idea is that if we can get enough states, maybe we can see some action at a federal level on that kind of legislation. Other questions? Or?
Yeah, John, I think you had a question.
Yes.
Yes.
You kind of lost me at the beginning of your mobile library comments.
Mm-hmm.
You named an individual. Who is he again, and what is he doing for us?
Oh, Michael Svendowski. He is a specialist in putting these vehicles together. He has expertise and helps libraries through the whole process of design, of setting out the layout, of working with the companies who are in the field on an RFP. So he basically is a consultant that helps libraries put this together because we don't necessarily have expertise in these areas, and he does.
And the RFP then is going out to the manufacturers?
Yeah, the RFP has gone out to anybody who wants to respond to it. It is out on the street, and So far, one manufacturer has responded to it.
Did the individual, was he selected through an RFP?
We just make it available out to the public.
No, your consultant.
Yeah. Mm-hmm.
Did we RFP to find him?
I'm sorry, I'm not understanding your question.
Did we put out a request for a proposal to identify the consultant?
No, we didn't have to do that. We have to do that anytime we are going to spend more than $25,000. And we got him because of recommendation from other libraries who have used him.
And his costs are below that threshold?
Yes, it was $7,000.
Thank you.
Michael, and then another question with a comment too. You mentioned the groups that will use mobile library to reach out to. One of the groups I hope we can, it's always individuals who are involved in homeschooling. I remember pre-pandemic that we had talked to a woman from that group, and it never materialized for obvious reasons, but maybe that's one group that we also can add to the spectrum of organizations and groups that we can support through the mobile library.
Well, if there would be a place where any number of them would meet, and already they come very heavily to the library, and that's one place where we expect we could see these backpacks go. Although in a homeschooling situation, you might not need them. There's, if they're ever going to be coming to the library, as they often do, it could be that would be something they want as well. Plus, there's some school supplies in these backpacks as well. It's not just the backpacks themselves. So if there's ever a place where they would meet as a group, certainly that would be something that we can consider. I don't know that we'd be doing, individual house visits.
No, of course not, yeah.
But that would be, I believe that there are times when they gather, and it's not necessarily at the library. And if they want to do a reach out, and if that's, something that would be scalable, for 5 or 6 kids I can see us doing a visit. The mobile library will have books. It will have its own collection. So people will be able to check out right from the mobile library. So that would certainly be something we'd happily consider.
Yeah, because I understand that the number of homeschooling, amount of homeschooling really increased during the pandemic period. So now whether that'll fall back down again or not, or people will just continue in that mode, but it represents a fairly good number. I've never seen statistics of families that use homeschooling.
Yes. We do know that there was an increase, of course, during the pandemic, and but we already had a fairly substantial number of families in the county who do homeschooling. Yeah. So, but I've already sent an email out to a woman who does some work with smaller daycares. She had approached us a couple of years back and said, "Is there anything you can do to help us?" And of course, the pandemic came along. But we're hopeful that with this grant, we'll be able to reach out to not necessarily the larger, but even some of the smaller independent daycares and get them materials. So lots to be done with this, and I'm really excited about the opportunity that it's presenting to extend library services in the county. The next thing I have for you is a statement of our OPEB. That's the health insurance for retirees, and that was in your packet. That comes from Kevin Binder and Bolton, who also works with the county. Our plan is separate from the county, but we are able to get a better hiring rate because he is kind of doing group work for us. And you'll take a look at page 4 of that to get an overview of kind of where we are. And you'll see that we're funded at a little bit over 29%, which is actually nice because that's a couple percentage points higher than we have been in prior years. Of course, the total OPEB liability of almost $4.7 million, when we've got $1.4 million, we've got a long way to go to fully fund this. And anytime we have a budget surplus or we get some money back from the county if the healthcare costs weren't as high as expected. So this past year, we put in an additional $20,000. When that happens, we try to bump up the OPEB account, but it's largely dependent upon investments. We simply don't have the wherewithal to be funding that in a particularly aggressive way. Bolton tells me that don't think about the total, think about getting to 75%, and if you're even there, it will be self-sustaining, and that ultimately is the goal, is that the investments from the OPEB account can more than equal the costs, and it's dependent on the number of years a person was in the system, but we were paying anywhere from 15% of retirees' healthcare costs all the way up to 100% of a retiree's healthcare costs. So it's not an insubstantial amount that we pay. So we are, as I say, hopeful that over time this will become self-sustaining and we're not doing a pay-go out of pocket for those expenses.
May I ask for some clarification on page 4?
Yes.
Okay. So if I understand the content right in what you just said, the 29% is where we are against $4 million of estimated future liabilities?
Yes.
Well, it's kind of apples and oranges then, isn't it? Of course, we're going to be a long way away.
Well, true. I believe the county is farther along than we are in this, but there are some counties, but I believe St. Mary's has been particularly responsible about this. There are some counties in Maryland, and this was a Maryland mandate. This wasn't something we just said, oh, here's something we want the library to do. And this dates from long before I came here. So there are some counties that simply ignored it and are not doing this kind of investment and are doing a pay-go. I think that if you can get the money in there. But yeah, I mean, it's not surprising that we are we are a little bit lower than the total. I just, where we're ultimately going to, how we're ultimately going to get there is going to be a very long haul.
But at the same time, the target is moving away from us, isn't it?
Yes, it is, but not quite as fast as we at least recently caught up. So we're a couple of percentage points higher than we were in some previous years. So that's a good trend.
Do the commissioners contribute at all to closing that gap?
They contribute to the county. They do not contribute to, well, I'll take that back. We have $99,000 in our budget, which is earmarked for these expenditures. And in some years, we have, through pay-go, actually exceeded that amount. I've asked for additional funding for this, and that funding has not been granted to us.
So is that $99,000 for this, or is it for total
It's
operation?
for anything related to retiree health expenses, so that's where the pay-go money comes from. We pay out of pocket, and then if we don't spend that full amount, we'd like to put it into this account. But really what happens, as I said previously, is that if we've got a budget surplus on any given year, let's say we had a budget of, I'll just make up a number, 3.7 million, and we spent 900,000, and we had an additional $10,000, we would put that into this account. Has been kind of what we've been doing with any sort of surplus funds.
But overall, your progress is primarily driven by investment results.
Absolutely, yeah. I would say in the past 5 years, we've put I can get you an exact number if you want, but I think we've put about 50,000 in the last 5 years into this fund over and above. We did 20 twice, and I think there was another year we did 10. So yeah, it's almost all through investments. And when the stock market takes a hit, our amount that we list as on hand, our net fiduciary position obviously goes down. Fortunately, over time, the investments have grown substantially. And we'll be talking about that later.
Okay, thank you.
I'm also noticing, too, because we've had a number of retirees during the pandemic period, too, so it hasn't done a lot of damage to at least what our balance is.
Yes, and those employees in many cases were long-term, so we are going to be paying pretty much all those expenses as a retirement benefit.
No.
Which are not yet reflected in this, is that correct?
I don't know, it's been a while since those retirees occurred. It's 'cause-
Yeah, I think that this is the end of this fiscal year, so they probably should be
They should be,
factored
yeah, I
in.
would think so, yeah.
Okay.
Okay, well, we're going to go on to things that I do need approval on, and there's quite a few things here. And in many cases, the things that you will approve are quite small. In other cases, they are, a little bit more substantial. But let's go ahead and start going through them. The first is something that's happening through the regional libraries, and not specifically the Southern Maryland Regional Library Association. It's all the regionals. We're given a grant to help with facilities master studies. A facilities master study looks at the current buildings that a library has. It looks at those in the context of the community. So is the community growing? Where is the community growing? Where around this library branch are we seeing growth? What changes are happening there? St. Mary's County has a facility master study which dates to 2007. It's a little bit outdated. Now, I did have a update on just the Leonardtown portion of that done in 2016. And the reason why this is so important is that if you want to have a capital grant, and now the state is giving away $7.5 million a year as opposed to $5 million, you have to submit an updated facilities master study. Calvert and Charles already have an updated facility master study, so the state decided that they really didn't need to have another one, but they looked at us and said, okay, St. Mary's can be included in this. Now, with these grants, unlike our other two ARPA grants, there is a match. There's a 50% match. So our share of this match would be $9,435, which sounds like a lot of money. If we were to do a facilities master study on our own, it would be over $40,000. And you can see on that form, what if it were just us individually, they would be charging us. So this is an incredibly generous offer on the part of the state and the regional libraries to include us. The Friends and the Foundation, I'm sure, would be happy to pay for this, but it is an essential expense. They'll be, as I say, this is a firm that has done a lot of this work in Maryland. They'll be looking at all our facilities, and I think they're going to find that at least two of them, now Leonardtown obviously is probably not going to have a lot of changes, but I could easily see them calling for substantial necessary renovations in our other two branches, especially looking at the growth that's occurring in those areas. So it will be an issue to convince the county, hey, this library really needs some work. But if we're ever going to do that and take a part of that $7.5 million a year that's given away in state grants for capital projects, we'd need to have this. So I'm asking you to approve the expense for this.
Michael, when you say that an updated study is required for capital expense money, what is the shelf life of the previous study?
Well, when you're doing the grant request, they'd like you to have something as current as possible, but 5 years is not out of the question here. 2007, however, is just a little bit out of date.
14 years back, yeah. So if we do this, and it's done, and we're happy with it and everything, is that going to trigger, in our long-range plans, is that going to trigger a capital request?
Well, the county commissioners have, for the next 5 years and ongoing, probably set their capital improvement plan, but I would think that there's certainly things that we'd like to do. Will it automatically trigger that? No, but that will be in part your decision. For example, we applied for 2 upgrades to our facilities through the ARPA funds, which, looking at the guidelines the ARPA gave out, I thought we were eligible for, but the state decided that those were capital projects. So they said, because this kind of funding, which every year Maryland gets about $3 million to give away as a state to libraries, and this year they had 6 because of the ARPA funding. Typically, they won't support a capital project with that funding. I think that they could have with the ARPA money, but their decision was no, we're not going to fund any capital projects that way. But at Lexington Park, what we asked for was a drive-through and a parking lot improvement. And we were anticipating that costing $50,000. So updated facility master study would, assuming we can get a match somewhere, and it wouldn't necessarily even have to be the county, although I think that would be the most likely source, of $25,000, we could apply for the state for a $25,000 grant and probably come home with it. I think that that would be a small ask, and when we've been pretty successful in our grant applications. So if we could, and talking with the county, say, here's something that needs to be done to Lexington Park, and the stacks are far too tall. They need to be creating better sight lines there. The whole layout of the branch, we could fuse a couple of these spaces and have a far better, we need to take out one of the desks. That's a branch that really could use a complete modernization. It's a great facility for the late 1990s if we had even more staff than we do. For our current uses, it's a little outmoded and really could use a major redo. It's going to be a question of talking to the county and trying to get into their capital improvement plans, but this would allow us to do it. In any case, we need to have an updated plan.
I think you just answered my next question. So their 5-year roadmap right now does not have a line item in there for us.
No, it does not.
Thank you.
That's something we'd have to approach them about.
I move that we approve the consulting agreement with Smyrla for the facilities master study.
Okay, I'll second.
I do have a question.
Go ahead, John.
On page 5 of the consulting agreement, item number 18, everybody find it?
The non-discrimination in employment?
Yep. I'm surprised that there is no mention in there, even obliquely, about doing business with people who are not authorized to be employed in the United States.
I don't know I don't know labor law, but it seems to me that burden is on
Yeah, the employer.
the employer and not the people who are benefiting from hiring them. I don't know labor law.
Well,
but
to your point, if we make that a requirement of the hiring, the recipient of the contract, wouldn't that solve that problem?
I don't
Well,
This is just me, and I don't know labor law, but I don't see any point in involving ourselves in an aspect that should not affect us no matter what, because Smyrna is being held harmless no matter what. It says in the last paragraph there. So I don't know why we would want to include it and even get involved in that. That is not our burden. That is what is their name? HBM Architects' burden.
The other consideration, too, is, again, this agreement is signed by Smyrna, and I can tell you the whole history, and it's really not as relevant, but there's 16 employees, and so the likelihood, and we never would hire anybody there that wasn't qualified to work. So, there are certainly things you could include, but reality sets in that the size of the organization and the process of hiring would really make this unnecessary.
And then on the first page of the HBM Architects Exhibit A, I made a little note in the margin. I didn't see where they discussed ensuring that we are ADA compliant in all of our facilities.
Well, I would tend to agree with what Carolyn said. That's the obligation of the employer. So I'm not sure why the consultant would mandate that. That's basic to any employment law or any legislation dealing with employees, that you have to be compliant. So I'm not sure why that would be necessary. If that were to be an impediment to anything they do, then that's the obligation of the employer to rectify that.
We at the library take great pride in being compliant. In fact, we moved some of the shelving in the new Leonardtown Library to make sure that we were, because the shelving itself was compliant, but when you put books on it sticking out, it was not. So that's something that we at the library would have to do. But that's also something that I think that if we were not, a facilities master study might very well be taking a look at.
It actually says in the scope of work that part of it is their job would be to identify infrastructure deficiencies. And it seems to me that would be that's the umbrella that issue would be under. I understand what you're saying, and I agree with you, but I think it's addressed here because of their responsibility to identify infrastructure deficiencies, and that would include ADA.
Well, why don't we make it comma to include ADA?
Again,
Well, number one, it's not the role of this board to
Yeah.
augment the contract, because the contract is with Smyrna.
Well, but we're being asked to participate in a Smyrna contract, are we not?
but I mean, here's my feeling is, do you want to re-go over, I mean, do we want to redo this entire contract to include things, to specify things that, in my opinion, are already included in here? In other words, if they're going to identify infrastructure deficiencies, do we necessarily want to put to include ADA? I mean, to include what? What else do we want to include? That's their responsibility, and Smyrna's and ours eventually to make sure that they're doing that,
But if they don't, nobody's ever raised a red flag about it.
but if they don't, then they have not done their scope of work. It's identified in here that they would identify those deficiencies. If they don't, they didn't do the job. That's part of the job. I mean, again, I'm not a contractor.
I think you're on ADA, I think you're giving them too long a leash.
Again, it's a Smyrna issue. Maybe that's a.
Well, it's our issue if we sign this with Smyrna.
Our sites are already ADA compliant. That's one thing I don't worry about. I also think that they will probably be addressing those as part of the work. I don't know that calling that specifically out is necessary in light of how very much attention we and Smyrna indeed themselves have paid to this. And this is a company that has done substantial amounts of work for Maryland libraries. This is not their first rodeo. So I'm sure they're going to be aware of anything that will be related to ADA compliance.
Yeah, also, Mike, are we?
And if I read it correctly,
Go ahead,
excuse me.
Sandy.
If I read it correctly, there are several review points in this process where if we felt it had not been addressed, that it would be able to be addressed.
And we also are really grateful to Smyrla for this. We're not necessarily signing this contract ourselves. This is Smyrla signing the contract. So if we were going to add our signature, you're basically just approving, yes, Smyrla is going to include us in their contract. But if you want us to sign separately, this would have to completely redone, and frankly, I don't want to get involved with that. They've already got this set with HBM.
I call for the question.
Okay, well, are there any other questions or any? Okay, if not, all in favor indicate by saying aye.
Aye.
Aye. Opposed?
Aye.
Opposed?
The motion carries.
All right, our next looks at several different changes in the manuals. And the first is in the volunteer manual, and you'll see any additions that we've made to that in blue, and everything else that's already in black is as was. So there's basically on page 1, we've added our vision and mission statement. We've amended the age for youth volunteers. There's a fairly large section on basically what added duties might be. You'll see that there's also a list of things that volunteers will not be performing the following duties. And the reason for that is that under Maryland law, we cannot have volunteers doing something for which we pay professional library staff. So that is the reason for that exclusion. It's not a St. Mary's thing. That is a state issue there.
Michael, since we're contemplating using underage volunteers in the library, and I'm looking on page 2 of the guidelines up at the top, youth will be supervised more closely by library staff. Does the library have any policies about these underage children being allowed to be, I'm going to put this, off in groups by themselves or merely one-on-one with an adult?
Not specifically for that. Children under a certain age, and that age is 7, if you're younger than that, you're not allowed to be unaccompanied in the library.
Yeah, but now I'm talking about people working in the library, underage.
There's no specific policies that say they've got to be one-on-one with somebody. They will, in some instances, be doing, although now it's very rare. It used to be that at summer reading program, we had a volunteen table, and there'd be 2 volunteens there. And we've just not found that to be the most efficient use of volunteen time. But they are regularly supervised for what they do, but they're never going to always be one-on-one with an adult in the library. That wouldn't be the case for anybody of that age who's not working in the library.
Michael, just a quick question, not related to the policy itself, but I know we sort of scaled back or even stopped the volunteer activity. Are we now back in full force in terms of utilizing volunteers?
We have said we're going to start allowing volunteers again, but we are asking that they be vaccinated, and they will have to have all the behaviors that we're expecting from staff right now, which is masking for all, regardless of vaccination status. And we simply are not allowing volunteers in right now who are not vaccinated, and we do ask.
Okay.
Can we jump ahead to the guidelines section? Volunteer guidelines is the heading.
The other thing, John, if I can interrupt, we really should vote on these individually. So why don't we vote on the manual? and look at the guidelines as separately, just to be consistent with the way we normally treat policies. So I'll make the motion to accept the updated volunteer manual. Let me get a second?
I'll second.
Okay, second.
And I have a question then, where amended youth volunteers on page 1, that first blue section, youth must be age 14 or older. And I said, then at the top of the next page, youths under 16 must bring a signed volunteer contract. So we have kind of a 14-16 thing going here. Which prevails?
If you look, you see the original, that was in the original. So what prevails is that if you're 14 through 14 or 15, you will bring in that signed volunteer contract. 16 and older, you don't need it. And 16 is the age of consent in Maryland, and that is the reason for that number.
Okay. So that's where we pick up the difference between page 1 and page 2.
Yeah, exactly. At age 16, you have you're at the age of consent in Maryland, so we couldn't require them to have something signed by their parents. They don't need it legally.
They are adults at that age?
They have reached the age of consent, and they may marry, for example, without parental consent. So in some ways, they are adults. In other ways, they're not legally adults until 18 or 21, depending on what it is that they are doing. But Maryland, for example, you can get a driver's license at that age without parental consent.
You can sign a waiver to do dangerous activities at 16 in Maryland, like climbing and zip lining, without a parent's consent. So yes.
Okay, so any other comments, questions on the updated manual? If not, all in favor indicate by saying aye.
Aye.
Opposed?
Aye.
Okay, motion carries. Okay, the volunteer guidelines then, Michael.
And the guidelines are simply, instead of saying positions and duties available volunteers clearly defined by the staff, we just kind of define what some of those are. And again, the things they're not permitted to perform is not a St. Mary's thing, it is a statewide thing. You're not supposed to be having volunteers do things for which you would pay professional librarians.
So the first bullet under child volunteers, again, we see 13. Should that not be 14?
That's the original. The amended is below it.
Yeah,
That
so
whole first thing
look
is
down where, at the
original.
very bottom where it says child volunteers, it must be age 14 and older.
Wait a minute.
Maybe I'll have to have them do anything amended in red and the corrections in blue. I appreciate your question there, because I don't think that's entirely clear. But yes, the child volunteers at the very end, that's what it's supposed to say. So it has been, under the amended guidelines, changed to 14.
Oh, there it is, way down there, okay.
Yeah, thank you.
Yeah,
Good question.
I did the same thing, because I saw it, wait a minute, that's not consistent, then I had to go down and I found it.
Yep.
And somewhere I saw volunteering. So parental releases are necessary if the child needs medication, medical attention, et cetera. And yet, wasn't there a reference somewhere else that staff will not do this?
Staff will not do what? I'm sorry.
I don't understand the question either, I'm sorry.
Well, the staff will not provide medication or administer medications or whatever. Where did I see it?
The policy we just approved said library staff are not authorized to administer medication to volunteers. That was in the original. I don't know if it made it to the,
It is
Yeah.
there, but basically, I don't think that this is the staff administering it just so much as we need to be knowing for these underage kids that this is something that is expected. So the staff will
Right.
not be administering medication in any case. But if a kid says, all right, now I need to take my insulin, we need to know that fact. That's all that's saying, not that we're going to administer it.
Yeah, and that's very
Yeah.
common in HR practices and policies, that we're never going to administer, but we need to know about a condition you have or medication requirements.
You don't require them to leave their medication with an adult, correct? If they come in with medication, they keep it themselves?
That is absolutely theirs, yes. We would not be handling anyone's medication. We're not medical.
I'm just used to working with scouting where you go away and there's a med box and everything's locked up and an adult does have to administer it, but I think this is.
Yeah, we're not
that's
medically
pretty clear
trained,
that-
and librarians, unlike school officials, don't act in loco parentis. School officials can, in the absence of a parent or guardian, fill that role. In libraries, that is not the case. We cannot do that legally.
Yep.
Okay, so I'm going to go ahead and make the motion. I think we didn't do that yet, so I'll make the motion, we accept the volunteer guidelines.
I have
I'll
one more
second it.
question.
Why don't we, typically what we need to do is get the second, and the questions
A
will follow.
second.
Okay, John, you have a question?
What was your question?
There was a question.
Yeah, okay. So look at the page that begins study room policy in bold at the top.
Oh,
But
we're
on
not
that
there
yet.
yet. I'm sorry.
We're still on volunteer
right.
guidelines.
Yeah. Okay, so any other questions or comments about the volunteer guidelines? If not, all in favor indicate by saying aye.
Aye.
Opposed? Okay, thank you. Motion carries. Okay, onward.
All right, so now we're on to study room policy, personnel manual separations, and safe and secure manual workplace violence. And we've just got a couple of additions here. So the study room policy, you see the adjusted is the same, except that it adds 2 points. Any applicant making a room reservation must be at least 12 years of age, and children under the age of 12 must be accompanied by an adult.
Do we want a 12-year-old making a reservation?
For a study room? Why would they not be able to do a study room?
I'm just saying.
Oh,
It's different than the meeting rooms. I mean, it's a small room for tutoring or whatever.
Yeah, these rooms, there's 5 of them at Leonardtown, there's 3 at Lexington Park, or there's none at Charlotte Hall, although that would be a lovely thing to add if we ever can get a capital grant. We've talked about it, ways we might get into glass study rooms there. But yes, these are small spaces. They're either individual, but they'll seat 2 to 4 typically.
Okay, so I'll make the motion to accept the changes to the various policies. So I can get a second.
A second.
Second.
Okay. Any questions? I'll ask a question. Where we talk about requesting at least 2 weeks written resignation. No question about the phraseology.
yeah.
Oh, did you want to do these individually, or?
I thought we were doing them jointly, but all right, we can do them individually, but
It's up to you, yeah. It's up to
Maybe
you.
what we could do is just, are we done with study room policy?
Yes.
And then move on and then do all of those at one time?
We're not done because we have a motion and a second.
Not on this one yet.
Yes, we do.
We do.
well,
Yeah, we
yeah.
did.
Okay.
Yeah, I made the motion, and John's right, and we seconded all the changes, but we can look at them individually. I don't know if there are going to be a lot of questions, but we can do it individually. And before we already started the process. Why don't we treat it as one approval process? So one question's been raised about the study room policy. I don't have any others except about under the 2-week notification requirement, is that what this may do is if someone who is not a good performer, and frankly, they resign, do you really want them sticking around for 4 more weeks? Because they say, well, look, I opt to remain 6 weeks. You should have some ability to deny that request, and there's not really nothing in there that allows that.
All right, I want to make sure I understand your question. As I'm looking at the policy, resignation, what we're adding here is a formal signed letter indicating the last day of employment.
Right.
So, and that under these guidelines should be at least 2 weeks. It could be up to 6 weeks, but that's just appreciated. It may not be any more than 6 weeks. What is your question about this then?
Yeah, it really has nothing to do with the changes. That's fine. But again, an individual, let's take a person who's on staff, who frankly, you're glad it has resigned, and they say, well, but I'll stick around for 6 weeks. You have, under this policy, you can't say, well, thanks, but no thanks. Give you 2 weeks' notice, and then that ends your employment. That's what I'm getting at.
It's a request, not a requirement. St. Mary's County Library request.
But you have to treat all individuals the same, Sandy, otherwise you get into issues of discrimination.
The problem could be that if someone has, for example, a certain amount of leave time. Now, for example, if it were health that they require, we'd require a doctor's notice. But if someone's got some sort of amount of vacation time, you can pay them out. And in this case, we'd probably, if we were talking to somebody who, let's just say it were a mutual decision, I think that we could probably say 2 weeks is adequate. It doesn't, I don't think this ties our hands from doing that. It just says that that much is appreciated.
And I suspect that if it was a situation where the library is not sorry to see the back end of them, that they probably not going to want an additional 4 weeks over the 2.
Oh, you'd be surprised.
Well, I know, you never know.
Yeah.
But I would think it'd probably be a fairly rare occurrence.
Okay. Well, again,
In a system of this size.
yeah, again, these areas sort of straddle what is a very fine line. We're approving a policy, but I don't want to get involved in the operations of the library.
Well,
That's not
you're
our
an
role.
HR specialist, and I appreciate your concern about that. Practically, what probably happen in those cases, we'd probably just say, all right, this person's due a certain amount of payout. Here you go, bye. I don't know that, they could submit that, but I think that we would negotiate that kind of a thing and just say, let's see what we can do with this here. We very rarely see that as a circumstance, but yes, it's very well, we'd be very well advised to know that it could happen and to be able to make contingencies.
Yeah, we all come, Michael, from different experiences. My last company had 10,000 employees, so the likelihood, if we had a policy like this, a lot of people would take advantage of it. But your workforce, and again, it's just a suggestion, by no means a mandate.
Let me just make a note, and I will consider that for a future edition.
Okay, any other questions or comments? And why don't we just continue in this fashion, and then we'll vote in one single vote. Any other questions on that aspect of the changes?
On the personnel?
Personnel
part of it?
side, right. Okay, if not, we'll move on to Safe and Secure Manual. Any other questions about that portion of it?
My only question about that is, staff is aware of these code words?
Yes.
Okay.
That's just something that we review with them, and it works even better if you have a AV system that allows announcements to be made, but we don't necessarily have that in our libraries, although we ask for it at Leonardtown. Basically, the idea is that we've got these code words that if you hear them, people say, okay, this is an emergency situation, and I either should go there, or I should absolutely get away from there.
Michael, I have a quick question. How does this get out if we don't have a PA system?
Yes, how are the original words compromised?
Well, they can become too familiar when staff changes and the words, everybody knows what the code words might be. But I'm just curious how the announcement is made so that the staff are aware.
Michael, I can answer that.
Go ahead.
The original words were not compromised, they're just outdated.
Yeah.
And so the staff wanted something that was more relevant to current world. And as far as how it's done, it's simply done by word of mouth. If we're talking to somebody and you have that situation, you're going to turn to somebody else, use the code word in a sentence, they'll leave the desk and resend it to whoever needs to know.
Okay, thank you.
And as I say,
My bigger question,
go ahead.
I do have a concern that this document I'm not sure, but I'm assuming this document has been posted in public documents. I don't think our code words, I don't think we as a board need to know the code words, and now they're out. That was my concern.
But really, anybody knowing the code words doesn't compromise the integrity of the situation or what the library staff need to do. Whoever's in the library and creating an issue already knows they're in the library creating an issue, so not letting them know the code word.
Well, plus the definitions haven't changed. So now everybody has to remember, is it Mrs. Polly or is it Mr. Dewey?
Well, I think that's easy enough for them to, wrap their brain around.
I wouldn't bet on it since you don't use them every day.
Yeah, I think the only other problem it creates is you can't hire anybody named Watson or Polly. Okay, so anything you want to talk about in terms of any of these policies? If not, the motion's been made, the second's been made, so we'll go ahead and vote on all the changes to the policies that are included on this sheet.
Aye.
All in
Aye.
favor indicate by saying aye.
Aye.
Opposed?
Aye.
Okay. You're saying aye, Janice, I say okay, I assume, but,
Janice, you're muted.
yeah, you muted. Okay, well, I think we have enough votes to carry it. Okay, move on.
Okay,
Just
although
one more
there
point,
is,
and
go
I
ahead.
did say aye.
Oh, okay, thank you, Janice.
I think it's worth exploring after we listen to this, having the PA systems in the libraries,
Okay.
in all libraries.
Well, I happen to agree with that, and we just have to price them out and see what we'd be looking at. They can come in very handy at, for example, closing time. So you have the library will be closing in 5 minutes. Please gather your belongings and begin moving to an exit. If you have materials to check out, please do so immediately. You can tell I've done that more than once. The next one, makerspace policy and maker agreement, although there is some blue, those are hot links to documents. And this is a new policy that we wish to have in place for when we open our makerspace, and we are working to do that. We had hoped to have it already, but the pandemic has pushed us back a bit. This is basically just setting out some safety concerns about the use of equipment that, while I don't think it's going to be life-threatening for anybody, it can be misused, or there could be sharp things here. And basically just setting out some rules for the use of that space. And I ask you to consider approving it.
Okay, I'll make the motion to approve the makerspace policy.
Second.
Okay. Any questions, comments?
Yeah, I understand the 3D printing, but give me an example of something else we're covering here.
Well, for example, there's a machine called the Cricut, which cuts shapes and out of fabric or paper. It has some pretty sharp cutting surfaces. So that would be something that we'd want people to be trained in their use. Ultimately, it might have a sewing machine. And obviously, there's going to be a needle involved with that. We'll have ultimately, for example, a machine that will convert a photograph, just a regular photograph, into a digital image. And you just want to be misusing equipment. So it's basically any kind of equipment we're going to have in our makerspace. And those are some examples of things that we would like to have there.
Okay.
Okay, so I'll make the motion to accept the makerspace policy and agreement.
So
I get a second, I'm getting confused on something where we are with
ready for vote?
Right, okay, we're ready for a vote. All in favor indicate by saying aye.
Aye.
Opposed?
Aye.
Okay. I always have to remember to give you guys time to provide your vote. It's a little bit of a lag. Okay, the next one then, Michael, moving on.
Just some change in language for the existing 3D printing policy and Cricut use policy. There's a sentence there that, upon reflection, I didn't really understand what it meant, and that you see it crossed out. Use of the library's 3D printer does not constitute knowledge or acknowledgement of, and use of the library's 3D printer implies that the person using it is our action, or is our active entity here. But really it should be the library who doesn't have any knowledge of or acknowledge the use of a product. So I've just rephrased those to, I think, more exactly say what we're trying to say in this policy, which is that if somebody creates something using our 3D printer or our Cricut machine, that doesn't, just because they've used our machine, for example, to make, I don't know, something that's sharp edge, it doesn't mean we know it or we've approved it or we say, yes, that's an acceptable use of our machine. So to a degree, it's just basically saying this is on the user, and we don't necessarily say, because you've used our machine, we knew what you were doing.
Makes sense.
Okay. My thought, Michael, and then before you vote on this, but yeah, I think when wording changes are made that really are just a clarification or just a better form of the sentence or paragraph, that it doesn't need to go to the board. Just to make it easier for you, that because there's really no substantive change in the wording here, but that's be my recommendation.
I move that we accept the two changes.
I do have a wording recommendation. Should I wait for the motion?
Yeah, let's make the motion. Yeah, I was just talking about policies in general, but yeah, I'll make the motion to accept the policy. If I get a second.
How about for both 3D and Cricut?
Yeah, it's the exact same
They're the
sentence.
same change.
Yeah, it's
Yeah,
the same
okay.
for both,
Yeah,
yes.
that's right. Okay, why don't we combine them then and simplify? So I'll make the motion for 3D and the circuit, and if I get a second.
Second.
Okay, so now we have any discussions, comments, recommendations? Sandy?
I just wanted to say, instead of saying disclaims all knowledge and does not acknowledge responsibility for, can we just disclaim knowledge and responsibility and make it, disclaims all knowledge and responsibility for? I don't know whether that's tighter or if that is looser, but it just seems to me we want to disclaim everything.
Who
I think
actually,
the
who
sentence
actually
as
runs
written
the
covers
printer?
it, but, I mean, both your sentence and Michael's say the same thing to me.
Okay, if you think it's the same thing, I'm just saying does not acknowledge responsibility for. It, to me, sounds weaker than disclaims responsibility
Maybe
for.
does not accept responsibility.
Oh, okay.
So is that an official word change that
Well,
you'd
now,
like to see?
we're in discussion right now.
The machine is actually operated by the library, is it not?
My understanding.
Not necessarily. The Cricut machine, we train
for
people to
everything.
use it. The 3D printers, right now, they are operated by the library, and we accept we accept code that we will plug in. But ultimately, the hope is that we'll be able to train users who will be able to use the machine themselves.
Okay, so where are we
Do you
with
want to
this?
amend your?
Yeah, that's,
motion?
Well, are we making a change to it? Is that the consensus?
That's,
I'm not hard and fast. I just wanted to raise the question if we wanted a little stronger with the responsibility.
I kind of like Carolyn's
Having no
idea
responsibility.
of does not accept, rather than does not acknowledge responsibility. I think that's a little clearer and cleaner.
So do you want to amend your motion, or do we want to vote on your motion and then do another motion with the new change? Robert's rules.
I know. So many motions, I'm getting seasick. Okay, so
Sorry.
I guess what is the change then?
Change acknowledge to accept on both of those
Yeah.
policies.
Okay. Then you need the word all go out then too, right? I was saying that the library, no, I'll take it
No,
back. No,
it
did-
just changes
Just changes acknowledge to
acknowledge
accept.
to accept.
Yeah, okay.
So I second your motion.
Okay, so let me, so he said, so it's going to say what? Let's make sure we have the right wording. The library disclaims, that's where I'm, are you?
All knowledge of and does not accept
Oh,
responsibility
okay.
for.
Yeah, I'm looking at the first, okay, got it. Okay. So we'll, in effect, we'll have to have a
Question.
new motion because of the change to it, because,
Wait, didn't, I thought you amended your motion.
all right, I amended my motion.
I can see that working when the,
So now
Okay,
we're
yeah,
voting,
now we're, okay, now
we're
we're,
voting on this change.
this change, right. I always thought this job was easy, now,
I didn't think I gave it to you.
so I can see that working when the patron has been taught and is running the machine. I don't see how we hide under that if the library is running the machine. At that point, the library is the user, not the patron.
yeah, again, I'm not familiar enough, Michael, with the,
Well, do
Well-
they actually run it for them? I mean, my experience.
Well,
is-
right now, the 3D printer, for example, we take the print job and we give it to somebody. Now, if, for example, and there was talk of making like stealth guns, you can make a gun that will actually work with a 3D printer. And it turns out that that's really kind of complicated. But if we got that job, we'd simply say no. But let's say we get a order for something, we don't know what it is, it just like it's a widget, and somebody then says, aha, this widget is used to trigger a grenade, and you couldn't trace it. We wouldn't know that, and we'd be disclaiming responsibility for it. It's not on us, it's on you. Even if we're using the machine, we'd have the ability to say, and the policy clearly sets out, you can't use it to make something that's dangerous, that we know that. But if you make something we have no idea what it is, we still need to be covered, even if we're the ones running the machine for now.
okay, so,
Because basically, based on what I know about our 3D printer, what you're doing as a library is either taking someone's USB drive or taking an emailed file, and you're making sure the 3D printer's loaded with filament, and then it just goes to town.
Right.
And that it can run that file, yes. And then, but as I say, if we kind of will know ahead of time what the file is supposed to make.
Sure.
And so we can say, well, I'm sorry, we're not going to make you a plastic knife, a plastic hunting knife. But let's say, as I say, it's something we have no idea what it does. It just looks like a piece of plastic. We're not going to say, oh, we knew what that was, or we would accept responsibility for the use anybody makes of it. We're not going to accept responsibility for the use anybody makes of any of these things.
okay, so any other questions? Have all questions been cleared up? And also, as a reminder, we're voting on really two policies because of the wording change is reflected in both. So all in favor of change it to both policies, please indicate by saying aye.
Aye.
Opposed?
Aye. Aye.
Motion carries. Okay, back on.
Can I just make a note that this language is also in the makerspace policy that we already approved?
Okay.
So it needs to.
Needs
just
to be
the
changed
language
there
needs
too.
to be
Thank you.
consistent.
Okay.
Good catch, Sandy.
Sorry, I didn't think about it then.
It's in the
Good catch.
paragraph below the third bullet.
Okay. So now we can move on to COVID.
Okay, well, the next two are also new. And the first one is the employee COVID testing guidelines. Just so you know, this is largely cribbed from recently released federal guidelines. And it is consistent with the latest guidance from Centers for Disease Control and Prevention, and the Occupational Safety and Health Administration. Our attorney has reviewed this, and the health department hasn't gotten back in touch with me yet. Nobody else in the county, there might be some individual employers who have implemented a policy like that, or for all I know, a mandatory vaccination policy. But these are, we know from various court cases, something that's legal for an employer to do. And so what this does, and I'm sure you've all had a chance to read it, but just to summarize quickly, there's some things that are just more general about mask wearing right now, but it sets out some basic differences between vaccinated and unvaccinated employees. And we have about 6 unvaccinated employees in our system now. And some of them have health reasons for not being vaccinated, and none that I know of a religious objection, but then some who say they have no plans to get the vaccination, and those employees would be subject to a bit more restrictions. And you have asked to see this policy. As I say, our attorney has reviewed this. The health department is looking at it, but they're simply having somebody research if who else might be doing a policy like this, or their templates for it. It has been vetted, and it's really more a question of, is this, and it's really operational. I think probably under Maryland law, I have the authority just as a library director to say that's how it's going to be. But I did want you to have an opportunity to decide if that's something that you would like the library to be doing. So the primary difference will be that employees who are vaccinated may not have to physically distance or participate in weekly screening testing. We are asking those as employees wear masks during times of high transmission of the pandemic. I believe we're in a code red situation right now. They may do library-related travel, whereas unvaccinated employees would be asked to physically distance as well as wearing a mask, and would complete weekly screenings to weekly COVID tests as part of their employment. And we wouldn't allow them to travel outside the county on library-related business.
Okay. Well, let's, again, I want to really follow the typical process. I'll go ahead and make the motion, because also, as you saw, I get confused easily. So I'll make the motion to accept the COVID testing guidelines. I'm sure there'll be questions and comments, but I'll need a second.
I'll second.
Okay, thank you. Okay, so now, any questions, comments, thoughts?
I just have a concern about the requirement for testing, especially with rapid tests, having about a 50, I think I read a statistic this morning from a reliable source that they're about 58% accurate, and that false negatives happen. We saw it happen. I personally saw it happen with summer camp for some of my son's friends, having rapid positives and then coming home and not being positive. I just, with the masking and the distancing requirement and the percentage of people that are already vaccinated within the library, it just doesn't sit right with me personally.
What doesn't?
The requirement for weekly testing if you're not vaccinated. especially if you're not symptomatic. I just feel like that's, if you're not symptomatic, it's really, I don't feel like it's going to be enough of a positive that you're not, that you don't have COVID, or it may end up turning out that somebody has to test and they show up positive and they're not, and they've got time off for that till they can get a longer, more accurate test. And I just don't know how high the risk level is. I'm just not comfortable with it. And I'm sure that's not a popular opinion, and I'm sure I'm in the minority, but that's just, I will, if I vote no, that's why.
Sandy?
Well, let me say one thing first, and that is that you've asked to see this policy. Typically, when I present something to you, it is my recommendation. It's not like I'm hiding here, but I do want you to have this be your decision. So if a majority of you do not wish to see this policy in place, you're not disappointing me at all. This is for you to decide.
Well, I think, Mike, we need a
I
policy.
suspect I'm in the minority here, and that's okay.
Yeah, but I think, Sandy, what your concern is one item of the policy, right? Not the entire policy itself. Or is that?
Right,
Okay.
right.
So I have a question for you, Sandy. Is your concern about
Okay.
the validity of the various testing methodologies or the frequency? I mean, maybe we could go to a higher test level rather than a quickie test.
But then somebody can't come to work for 2 or 3 days. I don't think that's necessarily going to solve it. I guess I need a better feel for how much risk you think is out there with the small number of employees who are not vaccinated. If they're required to mask and if they're required to distance, is the weekly testing really necessary? I think is what is just what I'm asking, and other people may feel differently that it is. I just don't know what the risk level is. I know we're concerned about children in the library because children have not been able, children under 12 have not been able to be vaccinated. Is there enough exposure that it's really, that we've deemed it critical to have our employees test weekly?
So I get where you're coming from in terms of the total number of unvaccinated people on the staff. Maybe we should be focusing on what is an appropriate mask.
We have guidelines to that effect, and
Right.
Many people in the library are in fact double masking at this point. They have the surgical mask and then a cotton one over it if they're particularly concerned. So I think we're good as far as masking goes, and to address Sandy's point, other than the testing, the only thing that would be different about this than what we're just doing as a matter of practice will be all employees right now during times of high transmission are masking in workspaces unless it's a private office with the door closed or an air filter there. They're already masking in workspaces and out in the public. So the only difference between that is what we're doing is we'd say to the people who are not vaccinated, you also need a social distance. Our attorney raised a concern about this policy saying, if you're making people get a test, are you identifying them in some way so that the other people know their vaccination status? And that would be an unavoidable, I think, consequence of implementing this policy.
Yep.
Yeah, I think, and again, it's a couple of issues. One, it's degree of caution. And that's going to be a sort of a personal issue to all of us. What level of caution, the highest or something along the way. We've never talked about the issue, do we mandate vaccination too? But we're not at that point yet because I think our county is not quite at that point yet. So I think there are levels of caution that we can introduce. Personally, I do favor the maximum caution, which would require some degree of testing. But again, it's going to be an individual thought, not necessarily a collective one or for all of us.
Well, Michael, what would be the effect if we required, instead of rapid test, the 2-day, 3-day test?
Well, if we're requiring that every week and it be presented before somebody is cleared to work, we'd clearly not be able to schedule people early in the week. And while everybody these days probably has either a Friday or a Saturday shift, that would mean, and it would depend on how quickly the results could be back. I mean, it could be that the person wouldn't be cleared to work until the Thursday. Suddenly, they're not able to complete all their shifts in a week.
Right.
So that could be an issue for us.
I tend
And
to
I'm
err
assuming-
on the side of caution, having had to get a COVID test myself. And it was negative, thank goodness, but, I thought I'd done all my precautions, and yet I got sick. So I lean towards, even though they're not 100%, I know that, I lean towards the testing. And again, as Sandy says, it's an individual point of view, and I appreciate that. But I think everything we can do, we should do to try to be as cautious as we can.
Oops.
Okay, so I guess, Andy, are you making a motion then to delete that from the policy?
No, I'm not. I was just bringing a point of discussion just to get it out there to see if how everybody felt about it. I don't really think that there needs to be
Okay.
an amendment.
What is the quality of bullet number 6, the free tests available for the county? Are they the 3-day version or the 20-minute version or what?
They're the rapid test. When they take a test, or at least the one that I took, they take 2 samples, and one is immediate. It's, within that day. And the other one takes 48 to 72 hours.
The one we use at the college takes about 15 to 20 minutes.
That's for the quick one, but.
Yeah.
but
And that's
then-
for confirmation between the two?
Yeah, it's like a backup kind of, at least that's what they did for me.
It's like your rapid strep and the one that they send off when you get tested for strep.
Yeah, but the rapid one, by the end of the day, what the answer to that is. But they also tell you, they told me it's no more than 80% effective, so I don't know where the 58%, there's probably numbers all over, who knows?
I found that from the
but-
Healthline
But the
article.
point is,
yeah.
it's not 100% with the rapid, they know that, but, and just like anything else, there's gonna be
Well,
mistakes, but.
neither are the vaccinations 100%, so.
Yeah,
Right.
so,
Right.
but I tend to, let's protect as many people as we possibly can, as well as we can.
Okay, so we're not looking at another motion. I'll just make a couple of quick points, Michael, and they're minor. But under vaccinations, in the second paragraph, the word "in" says discussed in below. It's really discussed below. You don't need the word "in." The other thing I try to find, and again, admittedly, I went through it very quickly, but we use the term high transmission, and what's the other word?
Substantial.
Substantial. Are they defined in
It's CDC.
Yeah,
the CDC? Okay.
Yeah.
Okay.
There is a website that is
an
pointed to here that you can look at every county in the United States and see. And also, really what we're doing is we're going to follow the St. Mary's County Health Department recommendations. And right now, we are in a time of high transmission, yes.
Yeah, as long as because we mentioned high, low, substantial, moderate, and so there's a lot of words. The other thing I was, again, I'll throw it out, but it's just, we talk about it under it, travel outside the county. Employees should inform supervisors if traveling by plane, cruise ship, or train. Even though it's not as popular, should we include bus?
Aren't you just making?
I could say, public forms of transportation, and then, or we could add bus. Yes, I suppose that's probably, yeah.
I haven't taken a bus since 1972, but.
And then you
but
get
some
into
people-
Uber and Lyft. Just call it public conveyance.
Well, and cruise ships, because that's not really a public
Yeah,
conveyance.
public
but-
conveyance.
Sure it
Yeah.
is.
Why don't you throw the word bus in there? I think then we're pretty much covered, rather than trying to come up with wording to alter other things. Okay, so then,
One more question, though. Are we confident that we're tight on employment law concerns there as far as leaving ourselves open to any kind of vulnerability for lawsuits?
yeah, I think, Sandy, again, there's, and I'm not an attorney, but in employment law particularly, number one, a lot of companies are instituting policies that are much stricter, including mandatory. And already in the case that has become precedence was in Texas, where in the Houston court, they indicated that it's perfectly permissible for organizations to require testing. So, and I'm sure every other facet of testing that's, required, they can require inoculation, but I'm sure testing fits in the same category. That the current laws, the way laws are being interpreted, because there are lawsuits that, and there'll likely be more, as the practice of requiring vaccination or having extensive policies will raise legal objections, but none of them have gone anywhere. So I think we're pretty safe that
Yeah,
whatever we do.
Our attorney did review this with that in mind, and yes, there are entities, corporate entities, that are putting this specific policy, which is to say, if not vaccinated, you will have weekly or biweekly even tests into effect. And so I don't think, it's an excellent question, Sandy, but I don't think from a legal standpoint that we are facing any problems. I would say the only issue I could see would be one of morale. And that I don't see any way to mitigate that.
Yeah, and also too, Michael, there are organizations, primarily private corporations, so they're not under the same gun, but who are mandating that people have to be vaccinated to be employed.
Oh, absolutely, yes. Even more than this, and that's absolutely standing up in court.
Yeah.
As a means of protecting the public and other workers.
Okay, so the motion's been made and to accept the policy with those changes of deleting the word "in" and adding the bus as one of the transportation means.
All right, I've got the addition of the word bus. Help me out. So we can,
Yeah, it's just, and again, it's just a wording issue. Like,
Where
it's under
exactly
vaccinations on
that-
the first page. Under vaccinations, second paragraph, it says, in the very end, it says, as discussed in below. It's really just take out the word "in."
Okay.
And just a quick comment, I am going to, of course, vote, yes, we need to do this. I wholeheartedly agree. And we're only talking about 6 people, as Michael said, so let's concentrate on those that did do what they needed to do to support folks not getting this disease. And those that can't be vaccinated, if it's medical issues, then we understand that.
Michael, it's on page 1, the section under vaccinations, the second paragraph, the last sentence.
Okay.
Last few words say, and quarantine as
Oh,
discussed.
thank
in
you.
below.
I got it. There we go. There it is. Got it. Thank you.
Okay, so again, all in favor of accepting the policy as presented with those minor changes of the word "in" and the addition of the word "bus," please indicate by saying aye. Aye.
Aye.
Opposed?
And
Nay? I'm sorry, I'm
No,
not
that's-
anti-safety.
vote
I
your-
just,
vote-
Nothing wrong with that.
Vote your conscience, Sandy. I absolutely respect you for that. We had said that September 1st was going to be the implementation for this, just to give people time for it. So I will move forward on September 1st. And
Michael, can I ask you a question about the
Sure.
guidelines? We have low, medium, and high, and right now, we're in the high, we're in the red zone. Does the threshold change, or is only where you are changes against a fixed goalpost, for example?
My sense of this is that if the level of transmission goes down, that we can relax these, that these are primarily high level of transmission guidelines.
But that line that we're crossed to be high, that line is fixed in the CDC and the health
Yes,
department,
it
right?
is. Yes, yeah. They have a certain percentage that they say, or a number of cases based on population, where they say, okay, code red, condition red, and that's kind of more where we're working with these. And if, you know, I'm going to hope that by September 1st, we can just say, hey, you know what, that whole Delta thing fizzled and now we don't have any problems. Wouldn't that be wonderful? Do I think that's a likely scenario? Nah, probably not. So when, under the advisory of the health department, and I did get an email suggesting that this would be a good idea from the health department, we will have these in effect, and let's hope that the vaccination rate seems to be going up in the country with the Delta variant coming in, that this will be something that in the future we don't necessarily have to have in place.
Okay.
What's your window as far as, I guess, when you look at, it's every 2 weeks that the health department puts out data, correct? I know that's what the school system is going with. Everybody's starting masked, and they'll evaluate every 2 weeks to see if you're vaccinated. You know, they can possibly release some of the masking for vaccinated individuals, but I'm assuming we're going to go on either a week by week or bi-weekly basis.
I will go week by week based on the health department recommendations. Okay. I don't think they're going to on one day say, oh, guess what, we're relaxing restrictions, and the next day say, oh, never mind.
Right.
So as they update, we will update.
Okay. Well, I'm just looking at the CDC map, and it looks like we should move to Nebraska. We should all move to Nebraska because that's where the largest, lowest risk is right now.
Yeah, but it's Nebraska.
Yeah, but it's
Nothing but
Nebraska.
corn.
Yeah, I will refrain from making any comment about Nebraska, which is, I'm sure, a fine state.
Yes.
The final thing for us in terms of policies today, and yes, this has been a longer meeting than some we have had, but several things just came up, is our investment policy, and that is for your consideration.
To make sure I understand, is this for the library's 2 Vanguard funds, or are we talking about the OPEB?
This is OPEB, I would think. I mean, because again, you have to look at because primarily we're talking about a range of investments that may not be necessary.
The Vanguard, I should point out, the Vanguard accounts are a trustee account and not the library's account, so I do not think that this applies to them.
I think, John, we can talk about those and then make a determination, but I think right now, because we're dealing with a policy that relates to the larger fund, that's what we're really focusing on. Now, before we get into any discussion, again, what I'd like to do is talk through this and then maybe not vote on it, because there's 2 things I want to point out. That one area that I put it in there, but I'm really questioning whether we need it. And secondly, do we want, one, our consultant to review it, or do we want outside counsel to look at it? So based on the answer to those questions, we may not want to vote on this, but we may want to at least open up any issues or questions about it. So is there any thought about that we need to have legal review before we institute a policy like this?
Do you think we do? Is that why you brought it up, or?
It's hard, in all honesty, because I wrote it. So to really comment on what you've written is kind of difficult. I'm not convinced. I was convinced previously that we need to have outside counsel review it. I'm not so sure now. But again, I'm biased, so I have to admit to that. The only other thing, by the way, just to bring it out in the open, is that we also established a range that in which a fund may stray from its target goal. Again, it's very common. I've never had them in any policy that I've been involved with, because it can fluctuate primarily on the market activity, and I've never been involved in rebalancing in my career. But again, that's something that's just a personal thought. But I think the most critical issue is that, do we want an attorney to review it? And that's, again, a need. If not, then we would just discuss it and then forward it on. Any changes that are developed by an attorney, then we would have to revote at a later date. So,
What kind of an attorney are you talking about to look at this?
well, initially, my thought was if this was developed either by one of us or by an attorney, you would still need somebody who knows something about investments
Right.
to evaluate it. So, our attorney, I think, is very competent, but I'm not sure he had the expertise to.
I guess my question was more, do we need an attorney or do we need a different financial advisor?
Yeah, I guess it really wouldn't matter. You want an external review of
Right,
what I'm
right,
getting at,
okay.
by someone who is, obviously very familiar with these
Gotcha.
type of documents. So I'll leave it up to you if you want to, if you feel that, if not, then we can review this and vote on it, and then it's completed. Again, I don't feel it's necessary at this juncture, but again, if anybody here feels a necessity to have, outside of the content, I'm not talking about as it is, but should we have an outside counsel look at this before we vote on it? That's what I'm getting at.
I think to be on the safe side, we should. It's my opinion.
I think another set of eyes would probably not hurt. I'll be honest with you, I need a lot of this stuff explained to me, which is not uncommon, I think, for a lot of people who don't do investments on a regular basis. But I think another set of eyes is probably a good idea. If nothing else, just to say, give it a stamp of approval.
Okay.
Yeah, I agree.
Okay, then I'll ask the question then, do you want to have that done first before we discuss it and look at it? Or do you want to discuss it and look at it now, and then if any changes, we've done this before, but sometimes outside counsel will say, you need to change these words, and after we've already voted on it, but either way is fine, but,
I think it'd be more efficient if we had someone else look at it first
okay.
and go over it.
Agreed.
Yeah, I don't even know what questions to
I agree.
ask at this point, so.
Okay.
Well, I'll dissent on that because I think that, to your point, not sure whether outside counsel would have any expertise in, for example, the ratio of equities to fixed income. So theoretically, almost any numbers to them would be meaningless.
Yeah.
I think those are the things that we ought to clean up internally before we go paying an outside lawyer to see if we have any legal issues with the structure of it, not with the investments of it.
Yeah, and the challenge you have to actually, as I was doing this, I did talk to our financial advisor, and I said, because we were a 60-40, and I said, is 60, which is more prevalent in your experience, 60-40, 65-35? He gave me an entirely different ratio, which is much more geared toward equity. So again, you get into sometimes opinions and other facets of it. You can't have somebody look at a policy simply from a legal perspective that the wording and the terminology is sufficient in any policy. And I think most lawyers can do that. However, as you're right, I mean, there's terminology, there's elements to this that require some knowledge of investment. So yeah, the ideal person would be an attorney who writes investment policies. I don't know where we're going to find that person. So again, I'm open to either way. My suggestion would be to have attorney review it, hopefully, and we can talk to our counsel and say, look, this is what we need to do, give them a copy of it and say, do you feel you have the qualifications in the background to evaluate this policy, or do you recommend someone who could do so?
I think that makes sense, is start with him, because we've already got him on, on board. And then he's going to be honest. If he feels like this is not in his wheelhouse, he'll let us know about that. And hopefully be able to recommend somebody.
Okay, so I think the consensus, I understand your point, John, but I think the consensus is that we have outside counsel review it first, and hopefully with an understanding of some of the fundamentals and basics that are described here, and then we'll review it after that.
And that's where we can, I guess, discuss any allocation changes or juggle the numbers to make more sense if that's what we need to do.
Yeah.
But I like the idea of getting an overview
Okay.
first.
Okay, so is that the consensus, then
Yes.
we'll table this for now, have outside counsel review it, and Michael, if you can coordinate that.
Sure. I will send this to our attorney, Joshua Brewster, and I will copy you on that email.
Okay.
And he can indicate whether or not he feels comfortable reviewing this, or possibly make a recommendation if he
Right.
does not. And with any luck, we can have this reviewed before our next board meeting. So I will take care of that.
Okay. And if anybody has any questions, so they can email me, and I'll be glad to answer any questions.
That's a good idea, to have a list of, like, John, I know you probably have a couple things you want to throw in there, and,
Made a few notes.
yeah, and you know, hit them with that, so we're not going back and forth with whatever our counsel
Yeah,
is.
that's fine. Okay, so Michael, since we're not voting on the investment policy, then I'll go back to you.
Just
then.
a couple of updates. So a week from tomorrow, as far as I know, we are still on for presenting a biannual report to the county commissioners. My plan for that is to review the recently released annual report, which Laura did a fantastic job on, I thought, and talk about that in general. But I more specifically want to talk about the future, and specifically the ebook work and moving forward on that grant, and then begin the conversation about the mobile library. And I'm hopeful that the county commissioners will embrace the mobile library, wish to see it promoted, and although they cannot, of course, until they see their budget numbers, commit to giving us any kind of staffing support, that they'll be aware of it, and that they will know that this is something that could be a real asset for the county. So those will be the two emphases that I will have next week. As far as your attendance, you are invited to attend 9 o'clock in the morning, basically, and we're usually, after a couple of awards, which are usually fairly brief, you may tune in and watch it on the county Facebook page, or you may come here in person, and you're welcome to, but that's not required. I'm not expecting any questions of the board or something that you will have to comment upon. So if you wish to come, then that is fine, and I would welcome your appearance.
And that's 1 week at 9?
It's a week from tomorrow. Be here by 9 o'clock in the morning, because that's when the county commissioner meetings begin. And I'll let you know if that invitation gets rescinded, but as far as I know, that's when it's going to be on, which is, I believe, the 24th. September 21st is the State of the County event, and Carolyn has RSVP'd for that, as have a couple of library employees, but nobody else so far. That's at 11:30 to 1:30 in the volunteer fire station right next to the Lexington Park Library. If you wish to attend that event, let me know, and we will RSVP for you. Lunch is included. September 23rd through the 26th is the county fair, and the library has been asked to have a table there. We have said we will have a table, but because our table is inside one of the structures, that we cannot guarantee it will always be, somebody will always be there. Because of the COVID pandemic, we may have a situation where we need all hands on deck in the library. They prefer that you have somebody there all the time. We just can't guarantee that that's going to happen. So we'll be having volunteers, and it does count as work time there as much as possible, but we're telling the county we cannot guarantee we'll always be on hand. October 7th through 9th is the CORE conference in Baltimore. It's still in person, as far as I know. It will be the first American Library Association event that's in person since ALA Midwinter in 2020. October 7th is a pre-conference tour of 4 libraries. Pratt Library, the new Michael Bush Library in Annapolis, a community college library that's in Anne Arundel County and has a new library, and a newly renovated library up in Baltimore County. The reason I bring it up is because those are the libraries that the group I'm the co-chair of, the Architecture for Public Libraries, was able to get. So I got a personal stake. I will be going on the tour. If you wish to, we will arrange for you to do that. I probably won't be going to the rest of the conference, but I do want to go there for the tour since my group kind of arranged it. So with that, our next meeting is September 20th, either virtually or in the Chesapeake Building. And thank you so much.
Okay.
Thank
So
you.
before we close the meeting, then any question, thoughts from any member before we close?
Just one, Michael, is it too early at this meeting with the commissioners to plant the seed about the facility study?
I'd like to do it one thing at a time. I'd like to try to get staffing for the mobile library. I think that has to be priority one for us to make that project sustainable, and we've got the huge grant for it. So that's kind of what I'd like them to focus on. Besides, the facilities master study could be some time before it appears. These, they've got the whole grant period. I anticipate it's going to be done before winter, but I'd like to concentrate on that and then look at looking at possible renovations for the libraries then after we kind of have that nailed down. It may require some community support to work on that. As I say, I'm just hopeful they're going to say, this is a great idea, we're glad you're doing it, and support it fully. But we may need to bring some, of our daycare constituents and homeschooling constituents and other constituents out to support our idea. So let's concentrate on the one first, is my sense.
Okay.
Good question, though.
I have one more thing
Yes.
I forgot to mention it when I was doing the treasurer's report. I did have success with Vanguard today. They emailed me a PDF form that I need to get John added to the account, so I will bring that to the next meeting to get his signature, and we'll have him added on.
Okay, is there anything else? And we'll,
Yeah, but
Michael-
Michael, didn't you say that, did I misunderstand you, are those foundation funds?
No.
No, that's the board's account, that you, out of which you pay the intern, for example.
Then I get back to, is our policy going to apply to those funds too?
not at this juncture. We can look at it, but again, we really want to focus on the OPEB fund right now.
Yeah, that's, the policy that we had in front of us today was for St. Mary's County Library. If it were to apply to your Vanguard account, it would have to be to the trustees of St. Mary's County Library as well.
Equally to again, the amounts in those funds is not sufficient to divide up among the various alternatives that the policy indicates. So we can look at, it's a future project, but yeah, this is definitely for just the OPEB account at this point. Okay, no other questions or comments, and I'll close it.
It's a comment.
Go ahead.
I have a comment. I'd just like to, once again, Michael mentioned the back-to-school fair that the NAACP sponsored in partnership with the library. I'd like to thank the library, the Friends of the Library, St. Mary's County Public Schools, the Health Department, Recs and Parks, and all the agencies that participated. It went very well, and we are so appreciative of the community support that we got at that fair.
Okay.
Yeah, and if you ever want a smile on your face, come out and give away some backpacks, because the kids and the parents are just so appreciative. It's a lovely day. And they like those free books too. Thanks, friends.
Okay, well, that's done. Sandy, we hope you feel better soon and can join us certainly by next month. If not, I'll close this meeting.
Michael, can you stay on a few